Hello, how's everybody doing today? My name is Cole Calder. I'm a student physical therapist. Today we are going to be talking about how we can determine and define signs and symptoms of canalithiasis. We are going to be looking at the lateral semicircular canal. This is a right, but I just want to demonstrate with using this model. This is the lateral, this is the anterior, and this is the posterior. We're going to be looking at the left side. Oh look, my patient has finally came. Please go ahead and take a seat right here. Hello, my name is Cole Calder, student physical therapist. What is your name? Kaylin. I understand that you're having some dizziness sensations, and we're just going to take a look at a couple of tests. First, I just want you to just look straight ahead, just out to the wall. I'm just going to just look at your eyes and see what they're doing.
So the first test that the student physical therapist is performing is the spontaneous nystagmus, and really what he's looking for is for any abnormal eye movements while looking straight ahead. This could be a sign of an acute peripheral vestibular problem, but it is most often seen with a central deficit.
Okay, now Kaylin, so we're going to go ahead and I just want you to look at this black tip on the pin here, and I'm going to move it around, and I want you to just follow it with your eyes, okay? Try not to move your head. I'm going to place my hand on your head just to kind of keep it stable, okay? So go ahead and just look at the pin.
In this test right now, the smooth pursuit, the SPT is looking for any corrective saccades. Really, he wants to make sure that the movement of the eyes is as smooth as the pen. Given the diagnosis of left horizontal canalithiasis, you would not expect this to be impaired because a positive test would indicate a central deficit.
I want you to again look at the black tip of the pen right here, and whenever I tell you, I want you to look to my nose, and then when I tell you again, look back to the pen, okay? We're just going to do that a couple times. Just want to see how the eyes are moving. So go ahead and just keep your eye on the pen here. It's my nose, and then the pen, my nose, pin, nose, pin, nose, pin, nose, pin. Good. Now I'm just going to...
In the saccadic eye movement test, the SPT is again looking for smoothness of eye movements, and specifically he's looking for accuracy, latency, velocity, and really any disconjugate performance of the eyes.
Nose, pin, nose, pin, nose. Now we're going to just look at the pin here, and I just want you to hold just watch it as I move it back and forth. I'm going to hold it in a position. I just want you to keep your eye on the black tip of the pen. Okay? So I'm going to put my hand here. Good. Feeling any dizziness with this at all?
For this next test, the gaze holding nystagmus, the SPT is really looking for abnormal eye movements and nystagmus as well. Again, it is more of a central deficit issue, so you would not expect any positive test from given the diagnosis of the patient.
So now, Kaylin, we're going to be moving your head back and forth. And do you have any neck problems or anything that I need to be worried about? Okay. So just let me know if you feel any dizziness throughout the time that we're going to be moving your head a little bit around. The first one, I'm going to be moving your head back and forth in a rhythmic fashion, and then I'm going to stop at a position, okay? Great. Just relax for me. I'm just going to take your hands here. You just go and relax. Good. I'm just going to move. I want you to fixate on my nose. And I'm just going to move your head back and forth.
In this test, the rapid head thrust, the SPT is really looking for the patient's ability to maintain visual fixation on an object, in this case the SPT's nose. Given the diagnosis of horizontal canalithiasis, you could occasionally get a positive test result, but it may not always be positive when doing this test.
So now we're going to be doing a movement where you're going to be sitting, and then we're going to be laying down. I'm going to be controlling your head as you go down on your back, okay? So first I want you to do is just go ahead and put your legs up on the table, and bring your hands back. Just want to see where you reach. Good. If you could scoot back just a little bit, right there, perfect. Now go ahead and relax, just sit. Now I'm just going to take your head like this. And I just want you to relax, and we're going to go back down to sitting, okay? So whenever, yeah, and go ahead and place your hands on my arm here so you can control. I just want to go back, just real nice and easy, okay? So 3, 2.
Dix-Hallpike test is really testing the anterior and posterior canals for any canalithiasis or cupulolisthesis. The SPT would be looking for any nystagmus in a torsional and up or down beating fashion. In the case of our patient's diagnosis of left horizontal canalithiasis, you really wouldn't see a positive test result on this test because the left horizontal canal would result in a right beating nystagmus. That could not really be seen with the Dix-Hallpike.
And now back up. So now we're going to do it on this side. I just want to do the same thing. I want you to place your hands on my arm. Feeling any dizziness with this?
No.
Good. Bring it back up. Good. Right now we're going to go on to the back. We're going to move your head from side to side. I just want to see how, if you get any dizziness with that, or see how your eyes feel. Okay? So go ahead and lay on your back. I'm just going to take your nose a little bit here. I'm just going to go ahead and go here.
For the supine roll test, the SPT is again looking for nystagmus, but this time it's more of a strictly left and right nystagmus as opposed to the torsional component that is seen in the Dix-Hallpike. Given the diagnosis of left horizontal canalithiasis, you would expect the nystagmus to be worse when the patient's head is turned toward the affected ear, in this case, the left ear. Also, when performing this test, canalithiasis would primarily be shown with nystagmus that goes towards the ground, or also called geotropic, and will fatigue.
Okay, so now that we noticed that you felt dizziness on your left, when you rolled to your left side, we're going to do a little treatment. If you would, just go ahead and start, bring your legs over to the table, and just lay down very slowly. So now what I want you to do is I want you to roll onto your left shoulder, keeping your head with your shoulders, okay? So just keep it straight, just roll onto your left side. Good. Go up. I want you to hold there for 30 seconds.
During the treatment, the SPT is looking for reduction of dizziness at each position before moving on to the next. He also wants to make sure that the patient's head is maintained on the pillow for the duration of the treatment. Given the diagnosis of left horizontal canalithiasis, you would expect the patient to return to sitting with a lack of dizziness and reporting feeling better. After the treatment, you may want to send the patient home and come back and see how they're doing. If they report that they feel better and that their dizziness has improved, you may continue treatment on the left horizontal canal. If for whatever reason they report that their dizziness has not been resolved, you may want to reassess or refer.
Good. Now I want you to roll onto your back, keeping your head onto the pillow, okay? Good. Very good. Good. Hold that for 30 seconds. So now we're gonna roll onto our right side, on our right shoulder. Keep your head close to the pillow. And you might notice some dizziness. It's normal. Just if it gets too bad, let me know, okay? Hold this for 30 seconds. Now we're gonna roll. We're gonna tuck our chin first, and we're gonna roll onto our stomach, onto our elbows. Okay. So bring this elbow underneath you, elbows down, and you can hold that for 30 more seconds. Okay. And now we're gonna roll back to the left side. So bring this arm through, and back around to your left side, keeping your head close to the pillow. Okay. Okay, so now I want you to sit up, so I'm going to bring your legs over here. And I'll help you sit up. Are you feeling any dizziness right now?
Yeah.
And that is just a short video on how to look at and to treat left horizontal canalithiasis. If you like these videos and you want me to keep on posting them, please like the link below.